Richard, darling, I have something to tell you. Not everything stays in Vegas. We interrupt your regularly scheduled program for a breaking health alert. I'm Jenny with Gums 24 News, and we have just received disturbing reports of a biological bad boy on the loose. The perpetrator, syphilis. Yes, syphilis. Once thought to be nearly extinct, the slippery spirochete is making a bold return. In fact, experts are calling it the worst comeback tour since Nickelback. For more on this bacterial blast from the past, we go live to our field reporter, Talia, who's reporting outside a local dental office where tensions are definitely contagious. Talia, what are you seeing on the ground, or rather, in the mouth?
Thanks, Ginny. Talia Bush reporting here live outside Smile Today Dental, where the fluoride is flowing and the fear is palpable. The culprit behind this commotion? A little nasty bug called Treponema pedilium, a spirochete bacterium that is causing way more trouble than the teenager with the drum set. This bacteria causes syphilis and spreads primarily through direct contact with the chancer. Those painless sores that appear at the site of the infection, most commonly during intimate activity. And yes, oral transmission is absolutely on the table. Now, this isn't your average bacteria. Syphilis is a dramatic 4-stage life cycle that makes Game of Thrones look like a kid's cartoon. First, we have the primary stage. A painless chancer appears at the site of the infection, usually within 3 weeks. It's hard to spot sometimes and may go unnoticed, so it's like a quiet kid in class who just suddenly starts throwing paper airplanes. Big mistake if you ask me. Then it goes to secondary stage. This stage occurs weeks to months after the chancer heals. A rash may appear on your palms or soles of your feet, and a fever, swollen lymph nodes, and sores in the mouth. Your immune system is throwing a party you never wanted to attend. Next, the silent but dangerous latent stage. This final stage can last for years. The bacteria are still present in the body, but there are no symptoms. This stage is quiet, like your mischievous toddler in the other room, getting into something they know they shouldn't. Lastly, the deadly tertiary stage. If left untreated, syphilis comes back with a vengeance years later, targeting the heart, brain, and nervous system. It's like a sequel you didn't ask for, but here it is, wrecking your life with some serious damage. Total chaos. Syphilis may happen in Vegas, but doesn't stay in Vegas. Jenny, back to you.
Thanks, Talia. So, how do you catch the sneak before it wrecks your organs? Blood tests are the go-to. The rapid finger prick screening that was approved by the FDA in 2014 is a good option if you need tested now. If positive, a blood test called the fluorescent treponemal antibody absorption test is done, so all in all, trying to catch this is like trying to catch a cheater. You'll need receipts and a backup screenshot to prove it. Let's recap what symptoms you may notice when that bad bacteria enters your body. First, you may or may not notice that red sore or bump that seamlessly disappears with no pain. You think nothing of it. Then, after they disappear, like your crush when you admit your love for them, you start to feel sick. Rash on the palms and soles of your feet, fever, you may think it's hand, foot, and mouth, and not to go see a doctor because you know it's a virus and can't be treated. Once that finally goes away, you think you're in the clear, but little do you know that bacteria is spiraling around like confetti in the 2022 Colorado Stanley Cup Championship game. Then boom, it becomes deadly and causes damage to your nervous system, brain, and heart. It's like an episode of Squid Game, and spoiler alert, you didn't win the final prize money. The silver lining, syphilis is treatable with good old penicillin. You can stop the bacteria in its tracks like the Avalanche did to the Lightning on their 3-peat quest. If you can catch it early, the treatment is straightforward. Basically, 1 injection and you're on your way. Let's be clear, early diagnosis is key. Waiting too long gives syphilis the spotlight, and trust me, it does not deserve a standing ovation. So, if you or any of your friends believe they kissed the wrong frog, get tested, get treated, and maybe rethink your kissing strategy. Now, back to Talia for how this drama plays out in the dental chair.
Thanks, Ginny. I'm still outside here at Smile Today Dental, where hygienists are scrubbing, scaling, and side-eyeing anything suspicious. Now let's talk about syphilis effects and what's going on inside your mouth. Why your dental hygienist might suddenly look like a detective from CSI Oral Edition. Syphilis can cause oral cancers and mucus patches or ulcerations. These lesions might show up on your tongue, lips, and inside your cheeks, basically everywhere you didn't want a surprise. And here's the plot twist. These oral symptoms can easily be mistaken for other common conditions like aphthous ulcers, trauma, or even cold sores. So while your hygienist may not be diagnosing syphilis directly, they may spot something off and refer you to a medical professional. For dental professionals, this means strict infection control protocols, like wearing PPE, maintaining asepsis, and being extra careful when performing oral exams and cleanings. Because let's be real, nobody wants this uninvited spirochete joining their hygiene appointment. And if you have syphilis and you're receiving dental care, it is super important to let your provider know. This helps them to protect you, themselves, and the next patient in the chair. The bottom line, your mouth might be telling you your hygiene is something your Tinder date didn't. Stay honest, stay healthy, and don't ghost your dentist. Oh, and before we move on, congenital syphilis, total heartbreaker. This happens when a pregnant person passes syphilis to their baby during pregnancy or delivery. It can cause stillbirth, bone deformities, vision loss, mulberry molars, and Hutchinson incisors. Let me tell you folks, these tooth defects aren't as pretty as those tooth gem fads. So yes, this disease can start drama before you're even born. Definitely not the kind of baby shower surprise anybody wants. Back to you, Jenny. Jenny? 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 Sorry, folks, I've just been informed that Jenny is currently in a daze, possibly trying to recall where this all began. Our producers are saying that we can listen in to see what is going on in that brain of hers, shall we?
All right. Let's rewind a bit. Syphilis became a concern in Europe around the late 15th century, with the earliest recorded outbreaks dating back to 1495. Syphilis began to spread rapidly among soldiers in Naples during the Italian Wars. Here's the kicker: who gets all the credit for this wild spread? Well, Christopher Columbus and his crew might be to blame, according to the Columbus theory. When they sailed to the New World, let's just say they picked up more than they bargained for, bringing back one of the worst souvenirs imaginable. Classic Columbus move, right? Anyway, so no one could agree on where it came from. The French blamed the Italians blamed the Spanish, and the Spanish, well, they just blamed everyone. Kind of like when someone who passes gas and then yells, "Who stinks?" knowing it's them. And then we have King Henry VIII, who had, let me count, like 6 wives and a whole lot of bad health choices. Same goes for Al Capone. You'd think he was tough, but syphilis took him down faster than a gangster in a shootout. So, how did they treat it back then? Mercury. Yeah, because nothing says modern medicine like a toxic liquid metal. It's like they're doing the whole DIY approach to healthcare. Syphilis, the gift that keeps on giving. Let's get back to the present, where I think I need a nap after that history lesson.
Anyway, back to you, Talia, while I collect my thoughts.
You got it, Jenny. Well, folks, there you have it. Syphilis, the bacterial villain making a stunning return. But with the right knowledge, treatments, and a little bit of humor, you can keep this drama from starring in your life's plot. Remember, early detection, penicillin, and honesty with your healthcare provider are key. Talia Bush here with Gums 24 News, signing out.
So, moral of the story, keep your health in check, your kissing game on point, and don't be afraid to ask questions, even if it's about your mouth, or your heart, or, well, you know where we're going with this. That's all for today's breaking news. Stay safe, stay healthy, and remember, when in doubt, always check with your healthcare provider. This is Jenny Prude with Gums 24 News signing off. And now, if you'll excuse me, I think it's time to give my dentist a call.